Hi, I'm Harry. I'm an osteopath. I'm manage Manta Health, which is the foam rolling side of my business, and I also treat East of Eden. We're going to do some foam rolling mobility today for forearms, wrists, a little bit of sort of pecs and shoulders and mid-back, hopefully to free up the wrists and hands, help prevent any sort of repetitive strain things that are really common, and just to get you moving a little bit and a little bit looser, as well as hopefully having a bit of time just for you to focus on you. So we're going to start off with forearms. So forearms, you've got your wrist extensors, which come from the front of the elbow down to the wrist and hands. You've got your, wrist flexors, my bad. You've got your wrist extensors coming from the back, again, down to the arm. There's a lot of issues around elbows, around wrists for tendinopathy. And that's when, and tendinopathy is when the tendons of the muscles get a little bit inflamed and a bit sore, which is very common around here. The very famous one is obviously carpal tunnel, which is a combination of sort of different tendinopathies. So, due to computing and typing and all the rest of it, we often get very tight forearms. Climbers, golfers, anyone doing anything racket sporty often get really tight in these forearms, which can cause issues either at the elbow, so like tennis elbow or golfer's elbow, or lower down in the wrist. So we're going to stretch them out first of all. What we're going to do to begin with, again, you can do this kneeling, sitting, standing, whichever you prefer. We're going to bend our elbow, drop our wrist down, use the other hand to place a little bit of pressure through that wrist, and as we straighten that arm, we're going to keep our wrist pointing down. So from the front, we're coming through there to get a nice stretch through these muscles here. And I tend to hold it for just a couple of seconds, 5 seconds or so, come back and do it again. It's also really important because the the nerves that innervate, which sort of switch on these muscles through here and go into your wrist and hand, they literally pierce some of these muscles. So they go straight through the middle of them. Now, if those muscles are super tight, it can be a way where those nerves get a little pinched and irritated. So keeping them loose is always a good idea. And let's switch and do the other side. So wrist facing down, start with the bent elbow, straightening it out to get a stretch. Great. Let's do the opposite. So we're going to be working on our wrist flexors. So this time, bend elbow again, palm pressure on the wrist pointing down, and then straighten it out to get a stretch through here. Great. Let's do the same on the other side. Start with the bent elbow, stretch it out. Perfect. We're going to move on to our wrists. So your wrists are made up of small carpal bones, quite a lot of them. We're going to find this place underneath your thumb and above your stylo process. So that's the knobbly bit of your wrist at the bottom. And we're going to squeeze around if you can. If you've got really big wrists, hopefully you've got big hands to get around them. And as we squeeze, we're going to separate those carpal bones. So by applying a little bit of pressure, we're actually gapping the joints in between to allow them to breathe a little bit. And then we're going to rotate one way and then the other. And just keep on going one way for a moment, switch, and to the other. All the while maintaining a little bit of a pressure around those carpal bones to loosen them up. Going to do the same on the other side. So pinching around the bottom of the hand, squeezing a little bit to gap those bones and those joints, and then rotating one way and then the other. Brilliant. Let's do a bit of a prayer. So we're going to palms down, push those wrists down. And then the other way, push up. Great. Shake them out a little bit. Let's move on to our hands. So hands are obviously for gripping. What often happens though is because we spend a lot of time gripping things, we can often get tight and our thumbs can pull in a little bit, again, which then can predispose to things like carpal tunnel as everything's getting a little bit compressed and a bit tight. So it's really important to open out your hands every now and then. So the first one we're going to do, holding onto the thumb, we're just going to pull it back a little bit at a time, quite gently. Don't be too forceful, don't force it, just take it to where it wants to go. You can either go straight back or also back and out a little bit to get a stretch through here. And then we're going to pull a little bit of traction and wiggle that thumb one way and then the other. Really nice joint mobilisation for one of the joints that can often get a bit tired with work and age and life. Great, let's do the other side. So pull back. And then let's pull back and out. Perfect, a little bit of traction. So by traction I just mean pulling it out slightly, so separating the joint a little bit. Then rolling it one way, rolling it the other. Great, and then let's just open up. Okay, what we're going to do now is work into these muscles in here. So just with your thumb, just do a little bit of massage coming through the base. What I often suggest is if you do work at a desk, having something like a golf ball just in your top drawer, which you can pop out every now and just do some massage into these thenar muscles here and into the opposite side, hypothenar, this area. Really nice, but as we don't have a golf ball and the foam roller is a bit big, we'll just use our thumbs. And then the last thing we're going to do is really work on this webbing through here. So we're going to pinch it and then squeeze it out. Pinch it, squeeze it out, pinch it, squeeze it out. And then we're just going to pinch and hold. Great, let's do the other side. So a little bit of massage. So right into this nice fatty muscle through there. Don't be surprised if it's a bit more tender on your dominant hand compared to your less dominant. That's pretty normal. Great, and then let's do the webbing. So pinching and rolling through, pinching, rolling through, pinching, rolling through. And then let's just find that nice tender spot in the middle and just give it a little bit of a wiggle and a waggle. Great. Come onto all fours. So we're going to really spread our fingers out, and we're going to just move our body weight. So start with your hands directly beneath your shoulders, so don't have them too far out in front. And let's just move through here, one way and then the other. This is sore, so lots of people find weight bearing in extension in their wrists a bit uncomfortable. Come onto your knuckles, so it's your wrist is kind of much more in neutral, and then come through and do exactly the same thing. Just loading, changing the area of weight, and then let's open up and drive over. Great. Let's bring in the old foam roller. So we're going to use the central prongs on your forearms. So apply the weight down and then just roll through. Change the angle of your wrist a little bit to get slightly different muscles. Great, let's do the other side. Palm up, other arm across. And then when you find some of those sore spots, as usual, just oscillate and work them out. Great, let's do the other side, so palm down. For me, this isn't quite as bad, but I'm sure for some of you squash players and golfers out there, it will be pretty tender. Great. The other thing just to mention is that most of the muscles in your forearm, the sort of muscle bellies, are in the top sort of half to a third. As you get lower down, it becomes much more tenderness, so you don't need to worry about foam rolling the lower half of your forearms usually. It won't do any harm if you do, but foam rolling tends to work better on muscles than it does on tendons. Okay, great. Right, we've loosened off some tight forearms and hands from no doubt all the work we're doing at computers, etc. Let's come into our pecs. So again, they're another area that can get a little bit tight. So we're going to start with a foam roller fairly perpendicular to us. We want the foam roller to be targeting this sort of upper outer pec. If you're a lady, you don't want it coming too close, too far down over any breast tissue. And I've got my foam roller at a little bit of an angle. Pressure coming on, nice slow movements, quite small. Coming through there, and then we're going to do some nice sweeps to get into that muscle. Brilliant. Let's switch. So again, slight angle probably onto that upper outer chest, and then rolling through, and then some nice waves. You might hear my shoulder clicking a little bit, that's totally normal. And the rule is with clicking and popping, if it doesn't really hurt, don't worry too much about that. Oh, nice. Right, we're going to come onto our side. We're going to have our top leg just resting on the foam roller to keep us in neutral. We're going to have both arms out in front and rotate back and forth. Follow the arm with your head. Excellent to get your mid-back moving. Because our knee is resting on the foam roller, our lower back is sort of stabilised, and so we're really targeting the mid-back. And after that one, we're going to do some drag back. So a bit like, oh, nice. Drawing a bowstring on a big arrow, or a big bow. Coming back. Oh, nice. Let's switch. Top leg resting on the foam roller, arms out in front, up and over to begin with, mind the plants. Great, let's do some of the bowstrings. So pulling back and out. And then let's loop around. Back, out, and loop around. Perfect. Let's finish off with thread the needle with the foam roller. So we're going to roll underneath, get a really nice stretch and rotation through our mid-back. And switch. Palm facing up. Switch. Perfect. And then let's take it easy. Foam roller to the base of the skull. Let's get those parasympathetics working to help it all calm down. Just relax. Dropping that chin down. And come and sit up. Hope that was useful. Hope you feel a little bit looser, a little bit freer, and I'll see you next time.